I'm getting the supplies ready for today.
What are we up to?
We're going to change a dressing on a central line. At the same time, we're going to change the IV tubing and needleless connectors. Have you done that before?
No, but I've seen it.
Great. So, best practices for central line care and maintenance. What do you know about it?
Well, I know that a central line is a long, thin tube, typically inserted into a large vein. It provides direct access to the bloodstream.
Right. So that's why improper care can quickly result in bloodstream infections and other complications. Bloodstream infections are really serious and can be fatal. We really need to pay attention to that.
Understood.
Hello, Mr. Lewis. How are you today?
Hey, I'm doing very well. Much better. How are you?
I'm good, thank you. Oh, don't put those there. Put those on the table. I'd like to introduce you to our student nurse, Joe. Joe's going to be performing your central line care today.
Sure. Nice to meet you, Joe.
Nice to meet you, too.
Mr. Lewis called saying his dressing didn't look good.
Oh, no.
As a rule, dressings need to be assessed at least once per shift, and it's the responsibility of the patient care team to keep an eye on it. We always appreciate when our patients are looking out. So thank you, Mr. Lewis.
Of course. I do what I can.
It's really important to assess the need for the line every day. It's a direct pathway to the bloodstream. It goes all the way up to a vein near the heart or just inside the heart. So we need to be extra careful that we don't introduce harmful microbes into the central line, causing a bloodstream infection. Mr. Lewis still needs his central line in place because he's receiving IV antibiotics and TPN at night. I'm going to go ahead and wipe down the table with disinfectant. Now that the disinfectant has had a chance to dry, let's prepare our workspace. Okay, first things first. For central line care specifically, everyone in the room should wear a mask, including the patient. This is done to prevent the spread of bacteria when we talk, breathe, or if someone suddenly sneezes, which can happen. Now, what do you think is next?
Hand hygiene again? Because we touched ourselves, we don't want to contaminate the insertion site.
And that's right. There's going to be a lot of hand hygiene in this, and it is very critical. And what do you think is next?
The gloves.
That's right. To remove the old dressing, we start with non-sterile gloves.
It does look like it needs to be changed. The dressing is loose and it's coming off.
Right. There are actually a number of things to look for. If the dressing has become soiled or dirty, if it no longer adheres to the skin, if the edges are lifting up and extending into the transparent window, if the CHG gel pad has become saturated, cloudy, or squishy to the touch, or if there is blood extending outside the CHG pad, it needs to be changed. If you press on a gel pad and the indent of your finger remains, it has probably absorbed too much fluid, which can happen when a patient takes a shower without proper precautions. Otherwise, the central line dressings are changed every 7 days.
Should I go ahead and disconnect the IV tube?
Yes, you've clamped the line, so let's disconnect it and cap it off. What we don't want to do is loop it back on itself. It's recommended to use alcohol-impregnated caps to prevent contamination of the tube.
Okay, I'm going to go ahead and remove the dressing now.
Okay. When removing a dressing, it's important we take preventative measures to avoid adhesive-related skin injuries. For dressings that are strongly adhered to skin or hair, consider using a medical-grade adhesive remover. For gel pads that have adhered to the skin or central line, use alcohol swabs or wipes or sterile solutions to facilitate removal. Remove the dressing low and slow, keeping it close to the skin surface while pulling it back over itself. Good job. It looks like we don't have to remove any excess hair, but if we did, I would use single patient use scissors or disposable head surgical clippers. I would never shave though, as this increases risk for infection. After discarding the old dressing, hand hygiene, of course. Another important thing here, sometimes the central line pulls out during the dressing care. Do not push it back. That's a big no-no. If you see a central line that is a problem or needs a new line inserted, inform the provider and document it as appropriate. Next, we'll set up for the new dressing. Since we are using sterile tools, we need to set up using aseptic techniques to maintain the sterility of the supplies, and then we'll be ready to apply the new dressing. Next step, don the sterile gloves.
Okay, the insertion site looks good, so I'll disinfect the area before placing a new dressing with the CHG sponge.
Right. CHG is preferred unless the patient is chlorhexidine intolerant. In that case, you would use povidone iodine or 70% alcohol. Scrubbing technique is also important here. You should scrub in a weaving or hashtag pattern. For example, left, right, left. And then switching to up, down, up. We shouldn't be scrubbing in a circular motion. Okay? Now, this part is often done incorrectly. CHG is a strong antimicrobial agent. It needs time to work. Scrub for at least 30 seconds if the area is dry, like someone's chest or arm. If the area is moist, such as a femoral site or some neck sites, the scrubbing takes 2 minutes.
Oh, I can't get that now. If I do, I'll have to start over with hand hygiene and get a new pair of sterile gloves.
Yes, that's right. If you touch anything non-sterile during any point of care, you will have to rewash and reglove before continuing the line care. It's easy to forget.
Now we need to let it air dry.
For how long?
If a dry incision site, like a chest or arm, was scrubbed for 30 seconds, it has to dry for another 30 seconds. If the incision site is moist, like near the groin or for some places around the neck, it should dry for at least 1 minute.
Yes, and here, drying means air drying. Don't wipe the area with the gauze. Don't fan it. It makes no sense to use CHG if you're not letting it work. Another important piece of information here. For the most accurate instructions, always read the labels of the supplies your facility is using. It might be more, it might be less. Okay, 30 seconds of dry time is up.
Okay, before applying the dressing, we need to apply the skin barrier to protect the skin and help the dressing adhere.
Right. Apply using single strokes, kind of painting it on, but don't go back and forth, and don't go over the insertion site itself. Once you're finished, let it dry per the manufacturer's instructions, usually a minute.
Okay, now I'm ready to put on the dressing.
Great. Dressing adherence is one of the biggest problems we have, so it's important to do this right. First, peel the lining. Place the CHG gel pad over the insertion site. Okay? Don't stretch the dressing. Okay? Now, for best adhesion, apply firm pressure starting at the insertion site and working your way out to the edge of the dressing. You actually have to use pressure to activate the adhesive and make it work. Unneeded disruption can actually increase the risk of infection. Our goal is to keep this intact for 7 days. That means total adhesion. Use one hand to secure the border and remove the frame with the opposite hand.
Now I'll apply the securement tape strip.
Apply the securement tape strip under the device tubing and overlap it back onto the dressing. Then remove the securement tabs. Document the dressing change information on the documentation label and apply the documentation label on top of the dressing over the catheter lumens. Well done. One more thing. We need to change the needleless connectors and tubing. This last step is often forgotten, but if it's not correctly performed, anything you've already done isn't going to be enough to prevent infections. I've already primed your needleless connector with a saline syringe.
Great, thank you. Now I'm going to clamp the lumen and disconnect the old needleless connector. Then I'll scrub the hub.
Correct. Take an alcohol or CHG wipe and scrub for 5 seconds and then let it dry for another 5 seconds for alcohol or 20 seconds for CHG.
I guess we're gonna start another timer.
You guessed it. Now you'll connect the new needleless connector, unclamp the lumen, and flush with your saline. Then reclamp the lumen. Be sure to scrub that hub one more time. All right, now let's connect the IV tubing Okay, great. Now repeat that process for the other 2 lumens and ensure you are using a new wipe for each lumen. And let's place our alcohol protectors on the other 2 needleless connectors.
Perfect. All done. May I have your mask, please?
Everything okay, Mr. Lewis?
Yes, thank you so much.
Alrighty. So we're gonna go ahead and let you rest now. Please let us know if you need anything else.
Okay.
Good job, Joe. That kind of attention to detail really goes a long way in keeping our patients safe. That was excellent central line care.
Thanks.